Many parents often ask whether or not they should get a genetic test for their child. Even though a child's been diagnosed with a developmental disorder, oftentimes the genetic testing can be very beneficial for a number of reasons. One is it can help us more accurately explain the cause of that developmental disorder. So even though a child has a diagnosis of a developmental disorder, sometimes we're left wondering as to why. So genetic testing can be very important to help us identify the exact cause of that developmental disorder. Secondly, doing genetic testing, even though a child's been diagnosed with a developmental disorder, can be helpful because it can give us some indication of prognosis. So if a child has a specific genetic disorder, then we can better identify maybe that child's long-term outcome. Parents are often wondering, what's my child going to be like as an adult? What types of services are they going to need? What type of help or support are they going to need? And that genetic testing can be very critical to help us identify a long-term outcome for that child. Thirdly, using genetic testing can be helpful even though a child has a diagnosis of a developmental disorder, because it allows the parent and the treatment team to better understand what additional needs that child might have. Sometimes we can use that information for genetic testing. After the genetic testing's been done, we can use that information to help provide genetic counseling to the parents, help them better understand what their child's needs are, and that information can be critical for a treatment plan.